I'm Ashley.
And I'm Liz.
Welcome to Dancing in the Kitchen. We have an exciting interview here today with us. We've got Alon Lits of October Health. Hi, Alon.
Hi, guys. Thanks for having me.
Yeah, thanks for being here. So we're excited for this conversation. This is sort of a new path we're going down that we haven't really explored prior to today. We're going to be talking a lot about the intersection of technology and mental health. And Alon is the co-founder of a company called October Health. And October Health is a company that utilizes technology to support mental health. So Alon, let's kick off with just telling us a little bit about October Health, what it is, what it does, and then we'll go from there.
Yeah, so October Health, we really, try to think that we help people unlock their potential. We, are trying to change the way people think about mental health. I think traditionally, with mental health, we wait for problems to occur before we acknowledge issues and before we address issues. And our big focus is getting people into the system a lot earlier on so they can develop skills so they're better prepared to face adversity, challenge, trauma, claims. The world's changing at a rapid pace that we've never seen before. So we need to be far more proactive in developing our mental fitness so when these unexpected events occur, we can handle them.
That's music to our ears.
Yes, exactly.
Yeah, we're fully on board with that. Well, and as I understand it, you've got sort of two sides to October Health, one that's more for like corporate spaces and then one that's more for the general public. Can you talk about the differences there and how you serve both of those communities?
Yeah, so when we started on this journey, a big vision was how do we make mental health care more accessible? There is, a big issue where a large number of people who need support just can't access it. Often more pronounced in rural areas across America, where it's estimated that, as much as 20% of Americans do not have access to mental health professionals. So we do need to look at new approaches to ensure that people can get care. So the first point was how do we democratize access? And the way that we're trying to do that is by looking at new ways of providing support to people. So that's the first piece. Stigma is still a big issue where, unfortunately, people don't want to admit that they've got a challenge with their mental health. So often, you just don't get any care. And everything that we built in our system is really focused on reducing barrier and increasing access to care. And then the final point is there's no established triage to mental health care. If you hurt your shoulder, it's very clear what you would do. You would go to the hospital, maybe go to the ER, you'll be seen by a nurse, depending on severity, maybe go for x-rays. And then depending on the results of those x-rays, you'll be seen by the nurse or doctor or surgery. But what does that look like in the world of mental health? And really our focus is how can we better triage individuals so they understand what it is that they're dealing with as a starting point. Because often, people don't know what it is. Is it a bad day? Is it depression? Is it anxiety? And then once they've understood that, how they should enter the system and what type of care they should need. Going back to your question with that context in mind, we have a free version of our solution which anyone can download. They go to the App Store and search for October Health, or go to our website, October.health. Where they'll be able to access the base functionality, which includes, almost 18 hours of live sessions facilitated by experts. So these are live audio sessions where you can engage with the expert, learn from an expert on a particular topic. We're really focused on psychoeducation, everything from more traditional mental health related topics to topics like improving productivity or increasing the resilience for developing a high agency mindset. So not only on the issue side, but also on the skills development side. And in addition to that, we make a large number of assessments available for free, so people can understand what it is that they're dealing with and how they should access care. And finally, we do have an AI companion available for free to provide people with, guidance, mentorship, and support. Because unfortunately, a lot of people just don't have someone within their network that they can lean on when they need that guidance and support, and really about 24/7 care. So that's a free version of our solution. That we're not a non-for-profit, we're a for-profit company, and we try to marry profit with purpose. And how do we deliver this free version, hopefully in a sustainable manner? We sell our solution to corporate customers, and that includes an enhanced suite of features for our business users, where they've got access to the same functionality, but additional assessments, more ways that they can interact with our AI companion, an AI dietitian, AI coaching courses, a broad range of content. And then on the other side, very detailed analytics that always respect confidentiality and anonymity, will provide detailed insights to business leaders so they can understand what issues different teams may be facing, and importantly, how they can use that data to create a more positive culture. And we have modules covering everything from well-being to employee engagement and culture, to learning and development and holistic health, because ultimately all these elements are interrelated in some way. If you only try and solve for well-being, but you've got a poor culture, you're not going to fix the ultimate outcome of poor well-being without, fixing that corporate culture.
Yeah, I love that. And I love that you're putting it into the context of systems, because humans are social creatures. We exist in systems, and, you can't pull one lever without affecting the whole. So
Yeah, and integrating it on a whole level versus like, oh, something happened. Sometimes you don't even recognize that you're really depressed or something's wrong until after. You're like, I think I might have been having an episode, or something might have been happening. You don't realize till after. So like putting it in a system where it can be like kind of utilized at all stages is like really important, I think.
yeah, I agree. I also want to kind of go back to what you were saying about triage for mental health. And in addition to stigma, I think there's real fear, because if someone's thinking about like, I'm so seriously depressed, I'm going to the hospital, there's a fear there of like, is this going to affect my job? Is it going to mean I'm going to lose my freedom temporarily? Or there's going to be like these consequences.
In work, because asking for help is always so hard, and then asking for help is the hardest part, but then being looked at a different way, or them thinking you can't handle your job because of other stresses in life.
Yeah. And even just like the interruption that like going down that sort of more traditional like psychiatric unit, et cetera, like that's not always, it may not be at the level where it needs that type of support. And to be able to meet people sooner in the process and give them those preventative tools and help them to be able to address it while it's still more manageable, I think is really powerful. I want to trace back now to who is Alon and what inspired you to co-found October Health. What brought you to this place of wanting to create this really amazing company?
Yeah, so appreciate that. And I'll touch on your point after this brief intro. I'm Alon, and one of the co-founders. My background's quite different. Interesting part of my career was that I joined Uber relatively early on. I was one of the first 200 employees globally. I was their first employee in Africa, initially general manager for Uber in Johannesburg, and ultimately director for their operations across sub-Saharan Africa. There were 7 countries, millions of riders, hundreds and thousands of drivers across the continent. And loved my time at Uber, and part of what I loved was this opportunity to drive, economic impact in countries where, unfortunately, unemployment was a reality. Providing, accessible economic opportunity and scalable economic opportunity was really powerful. And often there was just a lack of way to move around city. So it also provided independence to a lot of people. So I like that about Uber and Noodle Uber, which I did 5 years ago. I wanted to do something that kind of leverage my tech experience in either the world of education or healthcare. And then I was ultimately introduced to my co-founder. His name is Alon Lits, and he's the founder of the largest group of psychiatric hospitals in South Africa. And the way that Alon described his career, it's really been about scaling. So starting off in private practice, he's a psychotherapist treating 8 patients a day, to the hospital group that he was running, where there were over 800 patients on a daily basis, over 22,000 patients a year. And so, scaled his impact. And the next natural iteration after he sold that business was, how do you leverage technology? And, that then kind of was a match to my current sort of, I also joke that I come from a family of mental health professionals and that my mom was a social worker, or my wife's a psychotherapist, both with parents and mental health professionals. And that's difficult for me to get involved in. And, about their perspective. So we started on this journey 4 years ago now. And it's, a lot of learnings on, continuous evolution of the solution to meet our need to drive value. But yeah, I'm very fortunate to be in this world where we can hopefully do both, help people, address real problems, be better, unlock their potential, help better organizations, and then still, make the solution available to the general public for sure. So I just wanted to touch on a point that you made earlier, because I think it was so important, and it links, really well to your comment of stigma and people not knowing how to enter the system. So Alon, in his experience with the hospitals, what he used to note is people would come in on a Friday afternoon and then stay until the next Sunday. So, and why would they do that? Is because they would take 5 days of leave from work, because they didn't want anyone at work to know that they were actually being hospitalized for burnout. When in reality, you should probably be spending about 21 days to really go through the whole process, recovering from burnout, just as an example. But because the stigma was, so large, people just wouldn't want anyone in the workplace to know. So they would hide it by really going for 5 days off, coming in on the Friday afternoon to the Sunday, which is unfortunate. And I think part of the reason why people end up entering the system so late is that it's a hard thing to do. If you've never spoken about your mental health before, then, what's your option? You get in the room or in a call with a stranger speaking about a vulnerability. And that can obviously be cathartic, and that's obviously very beneficial. It's quite a scary step to take if you've never done it before. So everything that we've done and everything that we've designed with our solutions, how can we reduce those barriers? So one of the ways is you can join a live session, audio session. No one needs to know that you wear your fly on the wall. If you want to participate, you can do your name. You can chat using text. You don't need to raise your hand and take the mic and put yourself on a call. And then our AI features, interestingly, and I'm sure we'll chat about the pros and cons of AI later, that a lot of people feel less judged by it. And then all of a sudden, a much softer entry point where they can open up and share vulnerabilities in a judgment-free zone.
Yeah, no, that's very true. And I was about to kind of veer direction in the conversation, so that's a great segue.
Get up, get up.